we've gone through the pregnancy journey and we have our bundle of joy, it's time to whip up that body into shape the healthy way. You know that generally during the pregnancy, you gain some weight due to the baby, the placenta, the general fluid retention and all that. But after delivery, you need to shed off some of the weight, and there are ways of doing this in a healthy way. Join me today as I talk to our guest speaker, our dietitian by profession, Sophia Ametefe. Let's move a little bit away from weight loss. Let's talk about breastfeeding.
Okay.
Yes, breastfeeding is generally, should I say, a nice experience for most women. It makes you feel like you are able to take care of your child. It helps with bonding. It helps, well, with some amount of weight loss because you are expending energy by breastfeeding. Are there some, can you give us a little highlights on breastfeeding and then enlighten us a little bit about it?
So for the mother, like you rightly said, there's going to be a greater bond created between mother and child. So often you'd realize that some of our fathers will become jealous because the children would easily reach out to mommy.
Yes, especially when they are boys.
Exactly. And then breast milk is the optimum nutrition you are giving to your baby. So in terms of brain development, in terms of weight gain, growth, you are getting everything 100% from breast milk.
Okay.
So that is why we encourage mothers to go all out and exclusively breastfeed. But then, of course, there are a few situations where breastfeeding may not be preferential. For instance, if the mother is sick or had some complications after delivery, or the child has lost the mom, or you have some mothers who really struggle, even with proper positioning and attachment, they still naturally do not lactate well.
Okay.
In such instances, you may require artificial feeds to be given. When you realize that mothers who exclusively breastfeed for the first 6 months, their children rarely fall sick.
Yes, they have all these reduced asthma attacks, allergic reactions, and all that. So in actual fact, exclusive breastfeeding, it's supposed to be promoted for every woman. It's the best form of milk for your baby. So in the first 6 months of life, when your baby is mostly dependent on that, we advise the woman that that should be the main meal of the baby. So you breastfeed on demand. If a baby wants it every hour or every 2 hours, you can breastfeed. In addition to that, after baby has breastfed, it's advisable that if you still feel like there's some breast milk inside, you can express and then store for baby. It's been found out that storing breast milk in the freezer, the deepest part of the freezer, where you are most likely not going to open a lot of times, it can stay for as long as 6 months. When you put it in the fridge, it can stay for about 3 to 4 days. So all these are modes of storing your breast milk so that you don't have to express and then throw away, so in case the baby is not able to drink all the breast milk. It also helps for people who are restarting work. You know, generally in Ghana, we resume work around 3 months or 4 months or so. So after this time, you can express the breast milk, put it in the freezer or fridge, and then whoever is going to take care of your baby when you are away at work, that person can use the milk to feed the baby. The other things that I would also like to enlighten is the bottle or the other forms of using to breastfeed the baby. You may not be able to clean it properly. You may not be able to sterilize it properly. All these can cause problems for the baby. So usually we advise that you use a cup or use a spoon if it's possible to feed the baby.